Order, order. We start with questions to the Secretary of State for Health and Social Care, Graeme Downie.
Number 1, please, Mr Speaker.
Minister.
Mr Speaker, the delivery of mental health services for children in Scotland is the responsibility of the Scottish Government, and I hope they will make the best use of the boost from the recent budget to invest in mental health service. In England, we will support children and young people earlier by providing access to a specialist mental health professional in every school and roll out the Young Futures Hub in every community. We will also cut times by recruiting 8,500 more mental health workers across children and adult mental health services.
Graeme Downie.
Thank you, Mr Speaker, and I thank the Minister for that answer. The long-term impact of the COVID-19 pandemic on young people is often forgotten, with isolation leading to missed opportunities, lost life experiences and still unknown impacts on mental health. CAMHS referrals in Fife and across Scotland have skyrocketed, and despite a record budget settlement from this UK Labour Government, the SNP Scottish Government has told NHS Fife to not even bother asking for more funding to tackle this massive problem. Myself and colleagues will be writing to the Scottish Government regarding this issue. Will the Minister join me in urging the Scottish Government to reverse course and make sure young people have the support they deserve and need?
Minister.
Well, my honourable friend makes an excellent point on behalf of those young people, and it is disappointing that the Scottish Government don't seem to be allocating this funding as they might. I know he raises a powerful case, and I know that he will work very hard on behalf of his constituents with the Government in Edinburgh to make that a better situation for his constituents.
Damian Hinds.
Thank you, Mr Speaker. On the mental health support in schools that she just mentioned, is that the same as or different from the plan that was already being rolled out by the previous government for mental health support teams in schools?
Minister.
I thank the honourable member for his question. Our plan is to have universal coverage in every school, something that wasn't achieved by the last government, and we hope to make sure that that happens.
Dewhirst.
Thank you, Mr Speaker. This government will never shy away from taking the choices that are necessary to fix the public finances and to rebuild our public services. And it's thanks to those choices that we're able to invest an additional £3.7 billion in local authorities who provide social care in 25-26. We're also delivering the biggest uplift to the carers allowance since the 1970s, an £86 million uplift to the disabled facilities grant and a fair pay agreement for care workers.
Dewhirst.
Thank you, Mr Speaker. The increase in employers' national insurance contributions comes at a time for care providers when we simply cannot afford to lose any more provision. Age UK estimate that 2 million people aged 65 and over already have unmet care and support. So what assessment has the Minister made of the potential increase in unmet care needs as a result of this increase to employers' national insurance contributions?
Minister.
Mr Speaker, there's a pattern here. The party opposite welcomes the additional investment in health and care, but they oppose the choices that we've made to raise the revenue. So they need to tell us which services would they cut or which taxes would they raise instead.
Liberal Democrat spokesperson Helen Morgan.
Thank you very much, Mr Speaker. Coverage Care is a not-for-profit adult social care provider in North Shropshire, and it operates 11 care homes employing around 1,000 local staff. They've been in touch to say that the expected impact on them of increased national insurance contributions will be £840,000 a year in the first full year of implementation. Given that there are huge vacancies across adult social care in Shropshire, will the Secretary of State consider exempting social care providers from the national insurance increase, because it is putting money into social care with one hand and taking away with the other?
Minister.
Well, I refer the Honourable Lady to my previous answer regarding the very substantial funding that we're providing for local authorities, which of course are key to the adult social care system. But funding must always be married with reform. We've brought forward a packed programme of reform, from data sharing to empowering care workers to take on basic healthcare to promoting better use of care technologies. So in the spirit of cross-party collaboration, which we believe is absolutely vital and urgent in this area, I gently would encourage the Honourable Lady to see these reforms as the first steps towards rebuilding our care service and making it fit for the future.
Nestle Calliscan.
Mr Speaker.
Secretary of State.
Thank you, Mr Speaker. With your permission, I'll answer questions 3, 9 and 10 together. Today, there are 1,399 fewer full-time equivalent GPs than in 2015, and NHS dentistry is at death's door.
This government will fix the front door to the NHS. We've announced an additional £889 million in funding for general practice in 25-26, the biggest boost in years, and started hiring an extra 1,000 GPs to the front line already. And our 10-year health plan will shift the focus of healthcare out of hospital and into the community.
Thank you very much, Mr. Speaker, and can I thank the Secretary of State for his answer on a really critical issue, which is the access to GPs in primary healthcare. My constituency of Barking is woefully underserved by primary healthcare, in particular GPs. On average, each GP looks after 2,000 patients. The national average is 1,600. In particular, the area of Barking Riverside has no GP services. Will the Secretary of State meet with me to discuss this matter so that the thousands of homes that are being built will mean that there is also a primary healthcare facility on site?
Can I just remind people to look towards the chair because I can't hear what's being said? That's great. Secretary of State, I hope you heard.
Thank you, Mr. Speaker. I'd be delighted to meet with my honourable friend or my honourable friend, the Minister. The NHS has a statutory duty to ensure there are sufficient services, including general practice, in each local area, and it's vital that we take into account population growth and demographic changes too. I strongly support the Deputy Prime Minister's commitment to deliver 1.5 million new homes, and she and I know that must be accompanied with local healthcare facilities too, and we're working together to achieve just that.
Alistair Strapper.
Thank you, Mr. Speaker. I really welcome this government's focus on making sure everyone can see a GP when they need one. Locally, the crisis in GP provision nationally has been exacerbated by a failure under the last government for primary care investment to keep pace with housing growth. With such a low share of ICB capital funding allocated to primary care by the last government, how can we make sure we do much better in ensuring that GP capacity expands at the same time as local growth?
I'm grateful to my honourable friend for that question. He's been raising these issues with me, in fact, before he was elected to this place on behalf of the communities he represents. As I said to my honourable friend, the member for Barking, we must make sure that additional housing, which is desperately needed, is also accompanied through health and care services. The Deputy Prime Minister and I are working together to achieve just that, and thanks to the decision taken by the Chancellor in the budget, we are able to invest in the health and care services this country needs and deserves.
Callum Miller. Callum Miller.
The Woodstock surgery in my constituency is not fit for purpose. In September, heavy rain fell and caused the roof to collapse, causing the surgery to close. The nurse literally sees patients in a broom cupboard. The GPs want to increase their capacity to see more patients, but have been unable to access sufficient capital from the Integrated Care Board. So will the Secretary of State meet with me and the Woodstock GPs to discuss how the reforms announced yesterday will help them build a new surgery so that they can see patients faster?
I'm grateful to the honourable member for that question. I'm incredibly sorry to the staff in that practice and to the patients that it serves for the awful conditions in which they're having to be seen and the conditions in which they are having to see patients. I think that is the epitome of the broken general practice system that we inherited. Thanks to the decisions taken by the Chancellor in the budget, we are able to invest in the capital estate need in the NHS. It will take time. We'd be delighted to hear more about that individual case to see how the ICB and the NHS can assist.
Chair of the Select Committee, Leyland Brown.
Mr. Speaker, and following from the theme of my neighbour in Bicester, may I make a plea for Summertown Health Centre, my doctors, by the way, so I declare an interest. They operate in an old Victorian building, desperate to move to a new premises. They were the top of the priority list, but the ICB say that there is no money, and they say that they have no pots at all that they can bid into in order to get this seen to. So would the Secretary of State meet with me as well? You know, clearly there's £102 million spread across 50 projects in the country is not going to be sufficient. Can we get creative about how we can get Summertown Health Centre built in a new building?
Secretary of State.
Well, of course, Mr. Speaker, it would be daft of me to say no to the Chair of the Select Committee. Otherwise, she'll see me in less pleasant circumstances. But just to say, in all seriousness, we are looking creatively at this issue. There are enormous capital pressures right across the NHS estate. We're regularly lobbied on new hospitals, for example, but it's also general practice, the mental health estate, and the rest. We'll do as much as we can, as fast as we can, think creatively about how we can get more capital investment in. I'd be happy to discuss that with her further.
Sir Hazelgrove.
Thank you, Mr. Speaker. And when I'm out regularly knocking on doors and listening to people across the Filton and Bradley Stoke constituency, one of the issues that residents raise with me most frequently are the challenges in even being able to book a GP's appointment. Could the Secretary of State please set out what his plans are for ending that 8 a.m. phone scramble, including for those who don't use apps and websites as confidently?
Secretary of State.
I'm grateful to my honourable friend for that question. As the Prime Minister set out in our elective reform plan actually yesterday, we're determined to make sure that accessing NHS services, including general practice or dentistry or other primary care services, are as easy and convenient as accessing any other services at the touch of a button via our smartphones. We've committed to that in the elective reform plan, which will bring benefits right across the NHS as we modernise. And of course, she's right to mention those who might not be either digitally connected or might not want to access services in that way. That's why I believe very strongly in patient choice, different courses for different horses, and in freeing up telephone lines with people like me booking via the app. We'll of course free up telephone lines for those who would prefer to access services that way.
Seamus Logan.
Thank you, Mr. Speaker. Is the Secretary of State aware that the increases to employers' national insurance contributions is actually reducing patient access to primary care? I met with GP representatives in Aberdeenshire and Aberdeen recently, and they tell me two ways that that's happening. One, they're having to let staff go, and secondly, some of the GPs are going to have to consider meeting these costs from their own pockets. So will he consider an exemption for GP practices in relation to these charges?
Secretary of State.
Well, Mr. Speaker, a rare admission of failure by the SNP in this House. I'm very sorry to hear that general practice in Scotland is in such a sorry state, because here in England we're investing £889 million into general practice, the biggest uplift in years. That's in addition to the funding I found to employ 1,000 more GPs onto the front line before April, because we are prioritising general practice. And as for the decisions the Chancellor took in the budget, as I said before the election, all roads lead to Westminster, and thanks to the decision a Labour Chancellor has made here in Westminster, down that road from Westminster to Holyrood are the resources the SNP needs to deliver the priorities of the Scottish people. If they can't, then Anas Sarwar and Jackie Bailey stand ready to deliver.
Shadow Minister Dr Luke Evans.
To improve the access, Government has announced a planned expansion of advice and guidance, where GPs will be paid £20 per advice and guidance request for further expert advice from consultants. How does the Government expect this expansion to take place, and will it be mandating, given the current position of the BMA under their collective action is that GPs should, quote, stop engaging with e-referral advice and guidance pathway?
Mr. Speaker, I think the Shadow Minister will find that GPs welcome the £889 million uplift announced just before Christmas. That is the biggest boost to general practice in years. It is part of this government's agenda to fix the front door to the NHS and recognise the dire state that GPs were left under. Of course, with that investment comes reform. I think GPs would be delighted to manage more of their patients in the community if given the tools to do the job, and that's something this government is committed to do.
Dr Luke Evans.
Well, going back to advice and guidance, GPs use advice and guidance when they've come to the summit of their knowledge and need specialist input. For example, I might, as a GP, see a rheumatology patient, ask for advice from a rheumatologist who may advise for specialist blood tests. The problem is, as the inquiring clinician, I'm legally responsible for those blood tests and have to pay for them out of primary care budget. So does the government propose that £20 will cover subsequent follow-ups, cover the cost of the suggested tests, and will the government be looking at a legal framework change given the expansion of advice and guidance on accountability for those clinicians making requests?
Secretary of State.
Well, firstly, Mr. Speaker, of course, advice and guidance, as he's already said, does happen in general practice. We want to see more of it. We have to give GPs the tools to do the job, and that's what we're doing. My honourable friend, the Minister for Care, will be talking to the BMA shortly in the context of contract negotiations in the usual way. What the Shadow Minister neglects to mention is that these reforms and these improvements to general practice are made possible thanks to the £889 million we are putting in investment he and his party oppose.
Liberal Democrat spokesperson Helen Morgan.
Very much, Mr. Speaker. Dentistry is obviously a key part of primary care, and yet an estimated 5 million people in England have been left without an NHS dentist, and that's why today a petition is being handed in at Downing Street, signed by more than 250,000 people. We've moved on from the election, but we don't yet have a timetable on when the negotiations for a new NHS dental contract might begin and when the rollout of another 700,000 extra urgent appointments will begin. Can the Secretary of State confirm what the timetable is for those improvements and what the government's plans are specifically in relation to the new patient premium, and offer assurances to dentists that any changes to the current model will be outlined in detail to them as soon as possible?
Thank you, Mr. Speaker. I'm grateful to the honourable member for that question. We are looking at two things. Firstly, making sure we deliver what we said in our manifesto, including the 700,000 urgent appointments, and we're determined to deliver those as fast as we can. My honourable friend, the Minister for Care, is having discussions with the BDA to that effect. He is also looking very closely, as am I, at the money that is already going into NHS dentistry, how that money could be better spent, and why it is that year after year, despite people's teeth rotting to the extent that they're having to pull them out themselves, or children are attending A&E to have their teeth pulled out, how it is that year after year we saw consistent underspends in the dentistry budget under our predecessors. We're determined to give dentists the tools to do the job so that patients can see a dentist when they need one.
Duncan.
Question number 4, Mr. Speaker.
Minister.
Can I thank my honourable friend for his question and also for his campaigning on this important issue, and indeed for speaking so honestly about his own experiences during his time in this House. An additional £267 million has been invested this year to improve the quality and capacity of drug and alcohol treatment and recovery. We are committed to correcting the years of disinvestment in treatment and recovery services and ensuring that people can access the support they need.
Thank you, Mr. Speaker. The Minister's done it for me, but can I alert the colleagues to my interests in this area? Last month, the Advertising Standards Authority ruled against 7 companies posing as treatment providers or impartial advice services, or failing to make clear their role in earning commission, when they were in fact brokers. And I can tell the Minister that there are many more of these companies that escaped this particular ruling. They are able to mislead families whilst taking cuts of up to 40% of fees being paid directly to treatment providers. And they have, quite frankly, been able to run the sector like a racket. Can we make sure that this ruling by the Advertising Standards Authority is the start of something new, where we can seek to regulate practices properly? And could I ask the Minister to meet with me and interested parties?
Mr. Speaker, attempting to exploit people with addictions is reprehensible. Free drug and alcohol treatment is available in every part of the country, and I urge anyone struggling to anyone who's struggling right now to visit the NHS addiction website. The CQC has said that it could take legal action against companies misusing its logo, and Google has said that it would remove search listings from these companies too. I'm more than happy to meet my honourable friend to see what more we can do to stop this outrageous activity.
Jess Brownfuller.
One of the services provided by primary care services for drug and alcohol addiction is that of social prescribing, and it also supports the government's aim of moving from cure to prevention, which is why I was shocked to hear that a primary care network in my constituency are reviewing their social prescribing offering across the Chichester district and proposing removing it altogether. So does the Minister agree with me that social prescribing is a key pillar of our primary care services, and does the money that is used need to be ring-fenced to protect that service across the country?
Minister.
Social prescribing is one of the tools, and it's an important tool in addressing public health concerns in each of our constituencies. But look, this government is committed to ensuring that we get those shifts from sickness to prevention. We will be ensuring that local areas have public health funding in reasonable time. We're about to announce this year's allocations in due course, and we need to make sure that local systems maximise the use of their money, and that certainly includes social prescribing.
Thank you, Mr. Speaker. In 2022, there were over 10,000 deaths from alcohol use, and we know that over 600,000 people have an alcohol dependency. We don't need to just focus on treatment services and the funding of them, but also on prevention. The last government failed to bring forward a timely alcohol strategy. Could the Minister update the House on what he's doing to ensure that we are tackling this massive situation in our communities?
Minister.
My honourable friend raises a really important point here, and of course as part of the government's health mission we are producing a 5-point plan for prevention, and alcohol harms is one of those areas. I hope to be able to update her and this House in due course on the actions we will be taking to really drive down the prevalence of alcohol harms and indeed other addictions, because it is costing lives and causing misery in communities, and that's why this government is determined to tackle these public health problems.
Come on through, Mr. Shannon.
Very much for his answers. Minister, while there is community addiction services for those over the age of 18, worryingly across this great United Kingdom of Great Britain, those under the age of 18 are succumbing to alcohol addiction as well. So there doesn't seem to be any provision for those under 18. So I can ask the Minister very genuinely and helpfully, if I can, what the provision there would be for those under the age of 18, and will that be made available for the addiction problems are rising amongst the younger generation? Thank you.
The honourable gentleman raises a really important point here, and look, this government is committed to having the healthiest generation of children ever, and that means that we will have a concerted effort, Mr. Speaker, on a whole range of health issues that determine the health and well-being of young people, hopefully ensuring they become healthy adults as a consequence. Alcohol harms is certainly one of the considerations that we will be looking at.
Then Stewart.
Number 6, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. This government is delivering on its commitment to cut the NHS waiting lists and end the Tory backlog. We've taken immediate action with an additional £1.8 billion to support elective activity this year, funding that will support the delivery of our first step of 40,000 extra elective appointments a week. But of course, with investment must come reform, and the elective reform plan published yesterday and announced by the Prime Minister, sets out how we will cut NHS waits to the 18-week standard, increase productivity, reform the system and improve patients' choice and control over their own healthcare.
Stewart.
Mr. Speaker, almost 1 in 6 Scots are stuck in an NHS waiting list. People are borrowing money and remortgaging their homes to go private because they can't bear the pain. With an SNP government that has abandoned the principles of NHS free at the point of entry, would my right honourable friend agree with me that Scotland's health service needs a new direction?
I strongly agree with my honourable friend, and as I said during the general election campaign and quoted regularly by the SNP, all roads lead to Westminster. And down that road from Westminster is a record increase in funding for the Scottish Government through the Barnett formula. I know the Scottish Government published its own NHS recovery plan just before Christmas. I look forward to reading it, though I know some have expressed concerns at the lack of detail on plans to drive down waiting times. The Scottish people can therefore compare and contrast with the ambition of our elected reform plan, which was announced by the Prime Minister yesterday, and then decide at the next Scottish elections who they trust to govern, the SNP with their rotten record or a Labour government that will get on and deliver.
Sir David Davis.
The Secretary of State knows I wrote to him before Christmas about the planned ward closures and degradation of services at Bridlington District General Hospital. Doing so would take beds, facilities and indeed employees away from the National Health Service. That will do nothing but undermine his real attempts to reduce waiting lists, and indeed all the plans he announced yesterday. Will he look at these trust-level decision systems that lead to such catastrophic decisions, which will undermine every aspect of NHS strategy and all he's trying to do?
Can I thank the right honourable gentleman for his question and for writing to me before Christmas. I recognise the pressures that have been placed on NHS commissioners in recent years and the pressures that's put on service configurations. I tend to support devolution of decision-making with decisions about service reconfigurations taken closer to the communities they serve. I recognise also that commissioners don't always get it right, which is why engagement with members of Parliament and other democratically elected representatives is important, and ministerial oversight is important too. We will look seriously at the issues he raises, talk to NHS leaders. I know he will be doing the same. This is a government that's determined to give NHS leaders the tools to do the job so that we can get the right care in the right place at the right time, better experience for patients and better value for taxpayers' money.
Holly Billington.
Thank you, Mr. Speaker. In our growing community of Thanet, I'm sure my right honourable friend will share my delight that the NHS is currently looking to open the Thanet Integrated Hub in one of the most deprived parts of Kent. But perhaps he will also share my concern that Tory-run Kent County Council has now put in spurious objections to this development. Will he share my concern that unnecessary objections like this block access to healthcare and make it harder for the government and the NHS to cut waiting lists?
Yeah.
I'm grateful to my honourable friend for her question and for the work she's doing to improve health and care services for her constituents. This is a government that's giving health and care providers the tools to do the job. Of course, change will take time, but it is crucial, therefore, that we all pull together locally and nationally. And for the avoidance of doubt, this government is on the side of the builders, not the blockers.
Joyce Babarin.
Thank you, Mr. Speaker. The NHS Confederation has said that for the government to be able to drive down waiting lists, the pause to the delivery of the new hospital programme must be as short as possible, and NHS leaders need clarity about timelines. With that in mind, will the Secretary of State tell leaders at Eastbourne District General Hospital, as well as our community in Eastbourne, precisely when the new hospital programme review will be completed so that we can get cracking with our upgrade in town?
I thank the honourable member for that question. I agree with him about the need for clarity and also consistency, which is why we undertook the review into the new hospitals programme, because the previous timetable of the previous government was a work of fiction and the money wasn't there. I hope to report to him and to the House shortly on that, with the undertaking that the timetable we publish and the funding provided by the Chancellor in the budget and at the spending review will mean that we will provide not just clarity but consistency, which is important for NHS leaders, important for patients, and also important for our construction industry partners that we need to work with.
Shadow Minister Dr Caroline Johnson.
Thank you, Mr Deputy Speaker. Sorry, Mr. Well, that's the last time I get called then. Thank you, Mr. Speaker. Yesterday, the Secretary of State said in relation to the elective backlog, and I quote, "Where we can treat working people faster, we will, and we make no apology for doing so." Now, Labour politicians have struggled to define what they mean by working people, but his words have caused anxiety. Can he reassure those with disabilities that prevent them from working and retired elderly people who've worked all their lives that they will not be pushed to the back of the queue and that treatment will continue to be provided in the NHS on the basis of clinical need?
Secretary of State.
Of course, Mr. Speaker, clinical need is paramount and must always drive decision-making about who to treat, when, and the order in which people are treated. That's why I find the question posed so deeply disingenuous. We inherited NHS waiting lists that were record levels and waiting times which are frankly shameful. She should be apologising for her party's record, and she should also apologise for the two-tier healthcare system that sees those who can afford it paying to go private and those who can't afford it, working-class people, being left behind. That's the two-tier system this government is determined to end.
Can we just be a bit careful with the language we are using? Dr Caroline Johnson.
Thank you, Mr. Speaker. I think the Secretary of State needs to be careful with the words he used, as Mr Speaker said, because his words did cause anxiety amongst people. And it wasn't a disingenuous question, it was a genuine question to make sure that people are reassured. It will not have escaped the Secretary of State's notice that it's cold outside. Removal of the winter fuel allowance has reduced elderly people's ability to follow the Secretary of State's advice he gave last week, which was to turn the heating on. What assessment has he made of the number of additional admissions that have been caused by his removal of winter fuel allowance, and what effect is this having on the government's ability to deliver its reduction in elective backlogs?
Thank you, Mr Speaker. What the Shadow Minister neglects to mention is that the Chancellor has protected the winter fuel allowance for the poorest pensioners. She has also put in place the Warm Homes discount to assist people with their energy bills throughout the winter. If the Shadow Minister doesn't support the decisions the Chancellor took at the budget and ahead of the budget to raise vital investment for our health and care services, that's fair enough. But then she needs to tell people which NHS services is she cutting or which other taxes is she increasing.
Mr Speaker, we've made clear in response to the report by Dr Penny Dash that CQC is not fit for purpose and requires significant reform. We have increased our oversight of the CQC to ensure implementation of the recommendations in Dr Dash's review, and will continue to monitor CQC's progress through this period of improvement. We're also supporting the swift and efficient recruitment of CQC's leadership roles, including the new Chief Executive, Julian Hartley, who started in December.
George Fenton.
Thank you, Mr Speaker. It's inarguable that CQC needs some improvement, and many who run care services in local authorities have little confidence in their performance. So I wonder if my honourable friend will agree with me that we could go some way to improving how it's viewed by looking at the use of single-word assessments, which create undue stress in social services leads, and have been raised by the Dash Review as insufficient in supporting local authorities to improve, promoting box ticking over real improvement, and giving little information to members of the public on the quality of social services provision.
Okay. Minister.
I thank my honourable friend for that question, and he is right that confidence is the key word here in the huge agenda that the CQC now have to carry out. Dr Dash's review and Professor Mike Richards highlighted those serious failings that need to be readdressed. As one of our predecessors said, Mr Speaker, priorities are our language, and currently a review of 1 or 2 word ratings is not a priority, but that will be kept under review.
Greg Ricker.
Mr Speaker, does the Minister agree, and is she indicating that what she has alluded to today is a new start in the Care Quality Commission, and that things are going to change in terms of going forward for both staff and those who are the recipients of care?
I think the honourable gentleman makes an excellent point, particularly regarding staff who need support to continue the important work that they need. But absolutely, a new start with new leadership is absolutely what they need, and implementation of those recommendations.
Tom Gordon. Minister.
Thank you, Mr Speaker. With your permission, I'll answer questions 8 and 20 together. As Lord Darcy's independent investigation found, around 1 million people are waiting to access mental health services in England. This government will fix our broken mental health services by recruiting 8,500 more mental health workers, providing access to specialist mental health professionals in every school, and by rolling out Young Futures hubs in every community.
Tom Gordon.
Thank you, Mr Speaker. In my constituency of Harrogate and Knaresborough, we've heard harrowing stories from people who've tried to reach out and get access to mental health services before they reach crisis points. Often people end up facing months, if not years-long, waiting lists. And when it all too often does reach a crisis point, they end up having to access services as far away as Newcastle or Manchester. So what is the government doing to make sure that we can route local community mental health facilities in communities like Harrogate and Knaresborough?
I thank him for that question. In addition to the measures that I just set out, the Chancellor in the budget made funding available for expanding talking therapies for 380,000 extra patients. We have a £26 million capital investment scheme for mental health crisis centres, and we're also, as always with this government, investment goes with reform. We're reforming the Mental Health Act. Finally, that talk about doing that was first when Theresa May was in 10 Downing Street. This government is rolling up its sleeves and getting on with the job.
Gideon Ends.
Thank you, Mr Speaker.
Wellington is a trailblazer in taking mental health from hospital to community and from sickness to prevention. And the Trust is the first in the country to merge the mental health with the hospital trust. Will the Secretary of State meet with the Trust and myself to understand how successful that programme is, and also to discuss the much-needed maternity and paediatric unit at Musgrove Park Hospital?
Minister.
I thank the honourable gentleman for that question. It sounds like there's some very interesting and dynamic and innovative work going on in the areas that he mentions, and I'd be happy to meet with him to discuss it further.
Dr. Peter Brinsley.
Mr. Speaker, I have just been visited by my former medical student who tells me that as a young doctor in Yorkshire working on an ITU, 40 of the 50 patients who were admitted with COVID died. Many of the healthcare workers are suffering from flashbacks and post-traumatic stress disorder. I'd like to know what measures the government is going to take to look after the mental health of the healthcare workers who so bravely helped us during the COVID pandemic.
Minister.
Well, I thank my honourable friend for that question, and he raises a really important point. It's an opportunity for us all, I think, to reflect on the incredible work that those involved in our health service do provide. In many ways, they're heroes, and we should absolutely acknowledge that fact. I think we absolutely need to explore the point that he's raised, and perhaps we could meet to discuss it further. I'd also be very happy to write to him.
Anna Dixon.
Thank you, Mr. Speaker. In England, over 200,000 people were waiting for an autism assessment in September 2024. In my own constituency of Shipley, some adults have waited for more than 2 years for an autism assessment, and one child has been waiting 8 years and is still waiting to receive support from child and adolescent mental health services. These delays have a profound impact on people's lives. Will the Minister commit to the mental health investment standard and ensure, as the government reduces waiting times, it does so for physical and mental health services for young and adults? Thank you.
Minister.
I thank my honourable friend for that question. We do remain absolutely committed to the mental health investment standard. We've prioritised the expansion of NHS talking therapies and individual placement and support schemes, and we've provided £26 million of capital funding to open new mental health centres, but we're absolutely not complacent about this issue. The points that she makes about autism, that really is something that's a red light flashing on my dashboard, and I'd be happy to discuss that further with her.
So Desmond Swain.
9, sir.
11, don't worry. It's 11.
11, yeah.
Confusion. Who's doing 11?
I'm doing 11, sir.
Come on then,
Right.
let's have the Minister.
Got it. With your permission, I'll answer question 11, Mr. Speaker. Thank you very much. I thank the right honourable member for his question. Counsellors and psychotherapists form an integral part of the NHS mental health workforce, delivering support to people with mental ill health across a range of settings in both children and young people's and adult services. We will publish a refreshed NHS long-term workforce plan to ensure that the NHS has the right people in the right places with the right skills to deliver the care that patients need.
Sir Desmond.
Is there a plan to maintain service provision where psychotherapists and counsellors operating in the charity sector have been hit by eye-watering cost increases as a consequence of the national insurance increase?
Minister.
Well, as I have said in answers to previous questions, and as my right honourable friend, the Secretary of State, says, there is something of a pattern emerging here where colleagues on the benches opposite say that they welcome the investment that the government has made, but they oppose the revenue-raising measures, but they refuse to set out whether or not they would be increasing taxes or cutting services. And I still haven't heard an answer to that question from the benches opposite.
Tim Rhodes.
Question number 12, Mr. Speaker.
Secretary of State.
Thank you, Mr. Speaker. This government recognises the crisis in social care we inherited, which is why in the last 6 months we've taken steps through the budget to increase investment in social care, to deliver the biggest expansion of carers allowance since the 1970s, to invest in the disabled facilities grant. But of course, as my honourable friend alludes to, we cannot deliver great social care without the workers who deliver it. That's why I'm proud that the care worker turned Deputy Prime Minister did within the first 100 days include fair pay agreements on the face of her landmark employment rights bill, so that we can give our care staff not just the pay they deserve, but the professional status, recognising the hard work they do as caring professionals. That is a crucial step on our path to build a national care service.
Martin Rhodes.
Does the Secretary of State agree that the SNP's National Care Service Bill in Scotland was a missed opportunity to improve pay and conditions for social care workers, particularly when comparing it to Labour's Employment Rights Bill, which does create the Fair Pay Agreement for social care workers?
I do agree with my honourable friend. I'm proud that this government, as I said, has taken quick action within our first 100 days. Thanks to the Employment Rights Bill, which is a UK-wide piece of legislation, this Labour government in Westminster is giving the Scottish Government the tools they need to do the job on establishing fair pay for care staff. And if they don't do it, Anna Sarwar and Jackie Bailey will.
Martin Vickers.
Thank you, Mr. Speaker. In North East Lincolnshire, over 800 staff are employed by a social enterprise operation that provides health and social care. I've been approached by many of the staff who are unhappy that they have not benefited from the increases that NHS staff have gained. They've got the support of the RCN, and they're looking for the government to provide Care Plus Group who employ them with resources to ensure that they are recompensed to the same level. What is the Secretary of State able to pass on to them?
I'm grateful to the honourable member for that question. That's why, with our fair pay agreements, we'll be bringing together government, employers in both the public and private sector, and staff trade unions to negotiate the future for fair pay agreements that will benefit care workers right across the system and give them the professional status and career progression they deserve. Of course, the Chancellor also, through the budget, took steps to make sure we could invest in our social care services, and I'm deeply saddened that the party opposite has not supported that investment.
Dame Emily Thornley. Congratulations.
Thank you very much, Mr. Speaker. Question 13.
Minister.
Mr. Speaker, I thank my new Dame friend for her question. The Department doesn't collect data on the number of people who have specifically received enhanced maternity leave entitlements. Access to an enhanced maternity leave benefit forms part of the total reward package for a Gender for Change staff, which is critical, we believe, for retaining our much valued and needed NHS workforce.
Amendment.
Thank you very much. Doctors throughout the NHS, no matter who employs them, have blanket maternity agreements, but nurses don't. So when I visited the River Health Centre, I found that nurses employed by Whittington Health were working alongside nurses employed by the GP practice, and they got completely different maternity leave and pay. So as we turn out our hospitals into the community and we do much more work in that way, these anomalies are going to get worse. It's not fair. I wonder what my honourable friend is going to do about it.
I thank you for that question. She does highlight a problem throughout the system, not just in her area. Self-employed contractors to the NHS GP surgeries are not bound by the national terms and conditions and can develop their terms and conditions as they see fit. They do have the flexibility to set terms and conditions to aid recruitment and retention, and we would anticipate that good employers would set wage rates and terms and conditions that reflect the skills and experience of their staff. That is better for staff and for patients. I know she'll continue to highlight that with her local employer, and it's certainly something we need to keep an eye on as we develop services further.
Pippa Helen.
Thank you, Mr. Speaker. We all know... Question 14, thank you.
Mr. Speaker, we believe that every child deserves the best start in life. Due to the challenging fiscal context, we're prioritising family hubs and Start for Life funding to areas of high deprivation initially. We will consider the case for extension to South Cambridgeshire in future financial years.
Thank you, Mr. Speaker, and thank you for that response. We know how important early start in life is to give the best opportunities for all. Only half of upper-tier local authorities currently receive that prioritised Start for Life and Family Hub funding. 78 do not. In South Cambridgeshire, the offices are doing huge work to provide support and signposting without the dedicated funding, which means that babies, young parents, young families are not receiving the full benefits. Will you commit in the next spending review, will the Minister commit in the next spending review to committing that across the whole of England?
Yeah. Mr Speaker, local authorities were pre-selected using the income deprivation affecting children indices, average rank scores, with a rural and urban weighting applied. We know that tackling child inequalities in health and outcomes is absolutely crucial, and as resources allow, it is the ambition of this government to ensure that the Start for Life services reach every child.
Gregory Stafford.
Question 15, Mr Speaker.
Mr Speaker, I want to start by commending the Honourable Gentleman on his fundraising efforts to fight cancer in Surrey and his support for the brain tumour charity. We are committed to ensuring that people with brain tumours have access to more effective treatments and excellent care, including through our National Cancer Plan. We'll set out more details on this shortly.
Gregory Stafford.
I thank the Minister for the answer and for his Googling of my background. Early detection is essential to ensuring that brain tumours don't fall further behind other cancers. So can the Minister update us on what progress he's making to ensure that screening is prioritised in this government?
We absolutely want to ensure that there's early detection of these cancers. I've also recently met with the brain tumour charity to discuss how we can roll this out. Of course, this government is investing an awful lot of money when it comes to tackling cancers, but there's a lot more we can do when it comes to brain cancer.
Right, we come to topicals. Callum Miller.
Question number 1, Mr Speaker.
Secretary of State.
Thank you, Mr Speaker. We've been busy announcing investment in our hospices, an uplift in funding for general practice, action through the Disabled Facilities Grant, a new independent commission on adult social care, and yesterday the Prime Minister announced the elective reform plan. But as I said, the NHS is experiencing a period of significant winter challenge. The number of beds occupied with flu has been much higher than last year and is continuing to rise, with on average just over 4,200 beds occupied by patients with flu at the end of December, surpassing the peak of around 2,500 reported last year. We monitor the situation closely, working hand in hand with NHS England, care leaders, and I continue to chair weekly meetings with senior leaders from social care, NHS England and the UK Health Security Agency.
Callum Miller.
Thank you, Mr Speaker. I'm sure the Secretary of State will share my shock and anger that a number of young people in my constituency of Bristol and Woodstock are waiting over 4 years for a first assessment by child and adolescent mental health services. So can the Secretary of State confirm that the commitment made yesterday by the Prime Minister that patients will not wait for more than 18 weeks for a first appointment will apply to CAM services in Oxfordshire?
Mr Speaker, we are absolutely determined to improve the experience of children and young people on both mental health services and physical health services. I think there is more we are determined to do to make sure that mental health waits, paediatric waits are put into the spotlight and given the same attention as the overall elective backlog. I'm sure we'll have more to say about that when we publish the 10-year plan.
Adam Jogi.
Thank you very much, Mr Speaker. I want to pay tribute to my constituents in Newcastle-on-Tyne, Sheila and Joe Ward, who have long campaigned for the vaccine-injured and bereaved families after the death of their husband and father. There have been 16,824 claims received by the Vaccine Damage Payment Scheme. Can I ask the Minister when people who are still mourning the loss of a loved one can expect to receive the compensation they deserve?
Minister.
In September, the Secretary of State and I met with the families of those who have suffered harm following the COVID-19 vaccination, including his constituent Sheila Ward, where they raised the need for reform of the Vaccine Damage Payment Scheme. We listened closely to those families and what they've been through and agreed to look at a number of options, noting these may need to be cross-cutting government decisions. We're also working with NHS Business Services Authority to improve claimants' experiences of the scheme and ensure that claims are processed quickly.
Can I just remind members not to walk past when the Minister's answering the members just ask the question? Please, have regard for each other. It's just a bad example. Let's go to Shadow Secretary of State Adega.
Thank you, Mr. Speaker. In the Prime Minister's announcement yesterday of his elective recovery plan, in fact mirroring that of Sir Sajid Javid in 2022, there was one aspect different. Our plan explicitly recognised the importance of the workforce being in place to deliver the 9 million extra tests and interpret the results, and set out plans to grow that workforce further. What plans does the Secretary of State have to boost the CDC-specific workforce over and above the plans he inherited from us to ensure his elective recovery plan is actually deliverable?
Secretary of State.
Mr. Speaker, the Shadow Secretary of State is absolutely right that we need the staff in place to do the job. That's why the funding announced by the Chancellor in the budget is absolutely central to delivery of this plan. Funding, I note, he opposes, which is deeply regrettable. But as well as additional funding, we also need to improve productivity. That's why the steps that are set out in the elective reform plan to free up not just patient appointments that are unnecessary or low clinical value, but also, crucially, staff time in productivity gains is also important, so that as well as making the most of the additional investment, we're also making the most and delivering value for taxpayers' money already going.
Come on, please help me a little bit. You've had a good run today. Don't spoil it. Come on, Adega.
Thank you, Mr. Speaker. On hospices, while his pre-Christmas hospice funding announcement was, of course, welcome, the vast bulk of it was in fact non-recurring capital funding, which cannot be used to help them cover the hiked employer national insurance tax on hospices' most precious asset, their staff. What steps is he taking to ensure that they receive recurring revenue funding to enable them to cover the additional costs?
Mr. Speaker, the £100 million capital investment we set out before Christmas is the biggest boost to hospice funding in a generation, and it comes on top of the £26 million we announced for the Children and Young People's Hospice Grant. He can't welcome the investment and keep opposing the means of raising it. Would he cut services or raise other taxes? He's got to answer.
Pharmacy First is an incredibly popular service that has allowed many residents in Chatham and Aylesford to be referred for illnesses or urgent repeat medicine supplies. Can the Minister indicate whether there warrants a further review and expansion of this offering to include further access to medicines, including those to treat common dental conditions with bacterial infections, so patients with these very painful emergency needs can seek immediate over-the-counter appointments?
Can we remember its topicals, please, Minister?
I thank my honourable friend. We're making a priority of resuming consultations with the sector to stabilise community pharmacy. Pharmacy First has built on existing services to increase the clinical scope. The conditions treated under Pharmacy First do vary across the UK, and the NHS will continue to keep this under review.
Claire Young.
Mr. Speaker, when we think of social care, we often think of those who are older, but at a recent device surgery, I met the mother of a 20-year-old with complex needs, which local services are unable to meet. This means the only option that would allow him to engage with his peers is residential care further afield, taking him away from his family. Will the Minister meet with me, my constituent and his mother to discuss how we ensure those with complex needs are properly supported?
I thank her for that question. I'm sure she would welcome the fact that we've found an £86 million uplift for the Disabled Facilities Grant, but the specific question that she raises, of course, I'd be happy to meet with her and discuss that further.
Joe Platt.
Mr. Speaker, groups like Action for ME and Long COVID Support tirelessly advocate for improved care for over 2 million people living in the UK. How will the Minister ensure that NHS reforms deliver timely diagnosis, effective treatment and long-term support for those affected?
My honourable friend raises a really important point. Now, NHS England is due to complete a stocktake of long COVID services throughout England at the end of this month. This will provide an accurate, in-depth overview not only of long COVID services, but also now of ME/CSF FS services too. The stocktake will provide a comprehensive and accurate national picture, identify key challenges and make strategic recommendations for future service improvement, development and assurance.
Speaker,
since 2017 I've been raising the crisis facing East Kent Hospitals Trust.
7 different health secretaries across those 7 years have promised much but delivered nothing at all. Patients continue to face unacceptably long waits on trolleys in corridors, and last month the Kent Online paper compared these conditions to a war zone, with an average of 40 very ill patients a day facing more than 12-hour waits. Will the Secretary of State meet with me and the CEO of our trust, who's desperate for even the most basic diagnostic equipment, to ensure this doesn't continue to be the case for another 7 years?
Yes, Mr. Speaker. Either myself or the Minister of State for Health would be delighted to meet the honourable member. She's right to describe the scale of challenge in urgent and emergency care. Of course, there are other challenges in East Kent, particularly in maternity services, which I'm acutely aware of too, and we'd be delighted to work with her to help solve some of those challenges in her community.
Natasha Irons.
Thank you, Mr. Speaker. Mr. Speaker, the family dental practice in my constituency of Croydon East has faced significant challenges caused by dental contracts introduced by the previous government. The pilot scheme they took part in caused long-lasting operational financial damages to the practice. So how will the Secretary of State support practices like the family dental practice in my constituency, and will he consider measures such as rebasing the UDA targets to help them overcome these challenges?
I thank my honourable friend. She's absolutely right. The NHS dental contract simply is not working. We're working with the sector to reform the contract with a shift to focusing on prevention and the retention of NHS dentists. We will deliver on our pledge to provide 700,000 more urgent dental appointments at the earliest possible opportunity, targeting areas that need them most.
Tim Farron.
Mr. Speaker, 1 in 5 social care jobs in Cumbria is currently unfilled, and the consequences are unbearable for those who are vulnerable and indeed are causing pressure on the rest of the NHS. Will he look carefully at the specific needs of rural communities like ours, where it's so much harder to recruit and retain social care workers?
Thank you, Mr. Speaker. I was in Cumbria only recently and struck by the fact that the care home I visited in Carlisle is delivering great intermediate care for the NHS at half the price of a hospital bed. A really good example of how social care often delivers better value and better care. But he's right about the recruitment challenges. We're determined to work with local training providers and the local university to make sure we recruit, grow our own in Cumbria and keep them in Cumbria too.
Johnson.
The East of England ambulance service remains at the highest escalation level 4, as the call handlers in Bedford remain under immense pressure after assisting in responding to 39,000 calls between Christmas and New Year. Despite this unprecedented demand, the Trust is considering closing the Bedford Emergency Operations Centre, putting nearly 200 jobs at risk. Does the Secretary of State agree that with resources already stretched to the limit, we must keep the experienced staff in Bedford who have helped saving countless lives in the region?
Minister.
He is right to highlight the particular problems in his constituency. The decisions on configuration of these call centres are a matter for local trust in consultation with staff and representatives, and I encourage him to continue to engage with the trust in the interest of his constituents.
Greg Smyth.
Thank you, Mr. Speaker. Will the additional money announced for hospices before Christmas cover the full cost of the increase in employers' NI or not?
Oh, quick, Secretary of State.
Mr. Speaker, they can't on one breath welcome the investment and on the other hand condemn the means of raising it. Would they cut NHS and care services or would they raise other taxes? They've got to answer.
Councillor Smith.
Thank my honourable friend for securing the land purchase for the new hospital in Lancaster, and will he meet with me to discuss how a new hospital will transform health outcomes for my constituents?
I'd be delighted to meet my honourable friend. She was literally the first person to lobby me about her hospital immediately after the general election, having already lobbied me before. I'm delighted that, thanks to her efforts, we have been able to deliver for her community. Indeed, thanks to your efforts, Mr. Speaker, for yours too. And I'd be delighted to meet with her.
Mike Martin.
Becky's son, Will, was a normal, happy teenager until he suffered multiple COVID infections. His mother tried to find out what was wrong with him, but found that in Kent there were no paediatric long COVID care services. Will the Secretary of State update the House on whether Kent, with a population of 2 million, will ever get a paediatric long COVID service?
I'm very sorry to hear about the honourable gentleman's constituent, Mr Speaker. I know firsthand how complex and debilitating long COVID can be. As I mentioned in an earlier answer, there is a stock take taking place which should show where there are deficiencies. But let me make it clear, I want to ensure there are good services for people suffering with long COVID in every part of England.
Richard Quigley.
Mr Speaker, the Isle of Wight doesn't just have a problem with its ferries, you're expecting that. We also have a huge problem with dentistry. We are a true dental desert. However, the size of our community means we are ideal place to trial new approaches to dentistry, especially for children. Will you meet with me to discuss those approaches and improve dentistry on the island?
My honourable friend is absolutely right to describe the Isle of Wight as a dental desert. That's perhaps one of the reasons that the good people of that island elected a Labour member for the first time in history. Our ambition is to make sure that everyone who needs a dentist can get one. Sadly, 28% of adults in England, that's 13 million people, have an unmet need for NHS dentistry. I'd be glad to meet with my honourable friend to learn more about the experience of the Isle of Wight can improve services nationally.
Mr Speaker, prostate cancer is the most common cancer in men and yet has no national screening programme. This is something we worked on in government, and I thank the Secretary of State for also taking an interest in this area. So will he join me in commending Prostate Cancer Research's excellent new report and urge his team to consider the findings, not least for increased screening of at-risk groups, so that we can not just save the NHS money, but more importantly, also save thousands of lives?
Can I welcome the former Prime Minister's question? He's right to commend the research. We are actively looking at it, and since he's here, we're taking the bill through. Can I also thank him for his leadership on tobacco and vapes too?
Deirdre Costigan.
Thank you, Mr Speaker. The last government treated mental health as a Cinderella service, with my constituents waiting days in A&E to be admitted to hospital and to mental health wards. The Solace Centre in Ealing Southall provides help and support in the community for those with mental health problems at a fraction of the cost of a hospital stay. So how does he intend to move more mental health services from hospital to the community and to create more great services like the Solace Centre?
I thank my honourable friend for that excellent question. She's absolutely right. This is a vital part of moving from hospital to community. The Chancellor made funding available for 380,000 more talking therapies for patients and a £26 million capital investment scheme for mental health crisis centres. There's a lot of work done, but there's a lot more still to do.
Vicky Slade.
Thank you, Mr Speaker. Can the Secretary of State confirm what's being done to ensure patients with rare and complex conditions like functional neurological disorder and achalasia can access consistent coordinated care, including referrals to multidisciplinary teams that they need across the different symptoms that they experience?
The honourable member is absolutely right to raise cases where there are often multiple comorbidities or indeed complex conditions requiring a range of care services. That's why we need to design services around the patient and not expect patients to contort themselves around the services. Our approach to neighbourhood health services should make a real difference in this regard, but we've got to go further and faster on health and care integration, and we absolutely will.
Kevin McKenna, final question.
I strongly welcome the announcement yesterday about using things like community diagnostic centres to move services closer to the public. In places like the Isle of Sheppey, we're particularly exposed, but thankfully, as a coastal community, but thankfully with the new CDC, this will really help. Unfortunately, my experience in the NHS over the last few years showed that while the previous government talked about shifting care to the community, it failed to deliver. I would like to know from the Secretary of State what actual steps we're going to take for my constituents to show this is actually going to happen.
I'm delighted to have my honourable friend and his experience in this House standing up for his community and giving us his advice and wisdom as we develop our 10-year plan. We are already walking the talk on the shift to community, not least the big uplift in funding for general practice announced before Christmas, and the fact that even our elective reform plan, that lots of people assume is just about hospital waiting lists, a big part of that was delivering the left shift by asking and funding general practice to do more to manage patients in the community.
That completes questions. We'll let the front bench change over.